Good day, I am Dr. Yang. As a health expert, it is my privilege and responsibility to provide you with clear, comprehensive, and actionable information. Today, we are going to have a crucial conversation about a medication that touches the lives of millions around the world, Atorvastatin. This is not just a lecture, it is a dialogue for your well-being, a deep dive into understanding what this powerful drug does, the side effects it may carry, and the vital precautions you must take to ensure it works for you and not against you. So, please, settle in, open your minds, and let's empower ourselves with knowledge. Atorvastatin, perhaps better known by its most famous brand name, Lipitor, belongs to a class of drugs called statins. Its primary mission, its reason for being prescribed, is to wage a war on high cholesterol. It works masterfully by slowing down your liver's production of cholesterol itself, while simultaneously increasing your liver's ability to remove the low-density lipoprotein, or LDL cholesterol, the so-called bad cholesterol, from your blood. By doing this, it dramatically reduces your risk of heart attacks, strokes, and other devastating complications of cardiovascular disease. It is, without a doubt, a life-saving medication for countless individuals. However, like any powerful tool in medicine, it must be understood and respected. It is not a magic pill without consequences, and an informed patient is the most important partner in their own healthcare journey. Let's talk frankly about the side effects. It is essential to understand that a vast majority of people who take Atorvastatin experience little to no side effects, or may only experience very mild ones. But for those who do, being able to recognize them and distinguish between what is common and what is a medical emergency is paramount. We can broadly categorize these side effects into a few groups: common and less serious, less common but more serious, and rare but extremely serious. Starting with the more common side effects, these are often inconvenient but not typically dangerous. They include things like a mild headache, a sense of nausea or indigestion, diarrhea or constipation, and general muscle and joint pains. Many people report feeling these aches and pains, often a general soreness similar to what you might feel after a good workout, but without having done the exercise. These symptoms can sometimes appear when you first start the medication and may fade as your body adjusts. It is crucial that you do not dismiss these, especially muscle pain, but rather, you must report them to your doctor. They are a signal from your body. Now, we move into the territory of less common but more serious side effects that demand immediate medical attention. The most significant of these, and one that your doctor will have warned you about, involves the muscles. In a small percentage of people, Atorvastatin can cause a condition called myopathy, which is muscle damage. This isn't just a little soreness, this is often profound weakness, significant pain, and tenderness in the muscles that does not go away. If left unchecked, this can progress to a far more dangerous condition called rhabdomyolysis. This is where muscle cells break down and release their contents into your bloodstream. This can lead to severe kidney damage, kidney failure, and even death. The warning signs for this are unmistakable: severe, unexplained muscle pain, tenderness, or weakness, especially if accompanied by dark or tea-colored urine. If you experience this combination of symptoms, you must stop taking the medication and seek medical help immediately. Do not wait. This is a medical emergency. Another serious side effect involves the liver. Atorvastatin works on the liver, so it can sometimes cause an increase in liver enzymes, which is a marker of liver inflammation or stress. This is why your doctor will order regular blood tests to monitor your liver function. Typically, this increase is mild and does not cause any symptoms, but if it becomes severe, it can lead to actual liver damage. Symptoms of liver problems can include unusual fatigue, loss of appetite, pain in your upper abdomen, dark-colored urine, or yellowing of your skin or the whites of your eyes, which is jaundice. Again, these are red flags that require an immediate conversation with your physician. There are also neurological side effects that some people report, such as memory confusion or forgetfulness. The evidence for this is mixed, and it is not entirely clear how common it is, but it is a recognized potential side effect. Generally, these symptoms are reported to be reversible upon stopping the medication. Furthermore, there can be a small increase in blood sugar levels, which can sometimes lead to the development of type 2 diabetes. This risk is higher if you already have pre-diabetic markers or other risk factors for diabetes. Your doctor will weigh this risk against the tremendous benefit of preventing a heart attack or stroke. Now, let's discuss the rare but critical side effects. These include severe skin reactions, pancreatitis, which is inflammation of the pancreas, and immune-mediated necrotizing myopathy, an autoimmune disorder that attacks the muscles. These are exceptionally rare, but they are part of the complete picture of why vigilance and medical supervision are non-negotiable. Knowing these side effects is only half the battle. The other, equally critical half is understanding the precautions you must take to mitigate these risks and ensure your safety. This is a partnership between you and your doctor, and your role is active, not passive. First and foremost, the single most important precaution is complete and utter honesty with your doctor before you even take the first pill. You must provide your full medical history. Tell your doctor about any history of liver disease, kidney disease, or thyroid problems. Inform them if you drink alcohol excessively, as this can significantly increase the strain on your liver. You must disclose if you are pregnant, planning to become pregnant, or are breastfeeding, as atorvastatin can harm an unborn baby and should not be used by nursing mothers. Provide a comprehensive list of every other medication, supplement, and over-the-counter drug you are taking. This is not a trivial detail, it is a matter of safety. This brings us to the critical issue of drug interactions. Atorvastatin can interact dangerously with many other substances. For instance, certain antibiotics like clarithromycin, antifungal medications, and drugs used to treat HIV can dramatically increase the level of atorvastatin in your blood, thereby skyrocketing your risk of severe side effects like rhabdomyolysis. Another crucial interaction is with grapefruit juice. Consuming large amounts of grapefruit juice, more than a quart or about a liter per day, can interfere with the enzyme that breaks down atorvastatin in your digestive system, leading to dangerously high levels of the drug in your system. It is generally advised to avoid grapefruit juice altogether while on this medication. The next pillar of precaution is commitment to monitoring. Do not skip your blood tests. These are not optional. Your doctor will order baseline blood tests to check your cholesterol, liver, and kidney function before you start, and then periodically thereafter. These tests are your early warning system. They can detect a rise in liver enzymes or other issues long before you feel any symptoms, allowing your doctor to adjust your dose or change your medication proactively. Lifestyle is your greatest ally. Atorvastatin is not a substitute for a healthy lifestyle, it is a partner to it. Adhering to a heart-healthy diet low in saturated and trans fats, engaging in regular physical activity as approved by your doctor, maintaining a healthy weight, and not smoking will not only improve the drug's effectiveness but may also allow you to be on a lower, safer dose. Finally, be an active participant. Listen to your body. Keep a simple journal if you need to. Note any new aches, pains, or unusual sensations and report them to your doctor without delay. Do not fall into the trap of thinking it's nothing. When it comes to your health, there is no such thing as an overreaction to a potential warning sign. Never adjust your dose yourself, never double up on a missed dose, and never stop taking it without your doctor's guidance. Abruptly stopping can have consequences for your cardiovascular health. In conclusion, my friends, atorvastatin is a cornerstone of modern cardiovascular medicine. It has saved innumerable lives and prevented immeasurable suffering. Its benefits, for the vast majority, far outweigh its risks. But those risks are real. They are manageable, but they demand respect, awareness, and proactive management. Your health is your most valuable asset. Protecting it requires a team, your doctor, your pharmacist, and most importantly, you. You are the one who lives in your body. You are the first line of defense. Arm yourself with this knowledge, communicate openly with your healthcare team, and take an unwavering role in your own care. If you found this information valuable, if you believe that being informed is the first step to being healthy, then I have a request for you. Please, like this video or this article to let us know that this message is important. Subscribe to our channel or our newsletter, because we are committed to bringing you more content that empowers you to take control of your health. And most importantly, share this with your friends, your family, your loved ones. Share it on your social media. You never know who might need to hear this message. By sharing, you are not just passing along information, you could be playing a part in preventing a medical emergency, in saving a life. Knowledge is power, but shared knowledge is a public health service. Let's build a community of informed, healthy, and empowered individuals together. Thank you for your time, and take care of yourselves.